So, dear friends, as you know that I'm an educationist as well as diplomat. So, here I have the opportunity, the privilege, talking to Jennifer White, and I'm in the Types. The name of the organization is Types.
Yeah.
So, Jennifer, would you like to introduce your designation here, your duties, and your organization? Is it an acronym? What does it stand for?
Okay, so TYPE stands for Thinking in Pictures Educational Services.
Thinking
Thinking in Pictures
in Pictures,
Educational Services.
Educational Services.
And it was designed because children on the spectrum, so children with autism, often think in pictures.
Okay, children
Okay.
with autism and
And
they think in
others-
pictures.
yes,
Okay,
they think
images
in
like
pictures.
more images and photography and
Yes.
pictures, drawings, art.
Yes.
Is it like that? Okay.
Yes. They usually, like if you were to say shoe, they would then in their head picture multiple pairs of shoes of actual images that they've seen of shoes. So they actually think in pictures.
Okay, they think in pictures.
Yes,
So
okay.
Types is
Thinking in Pictures.
thinking in
Educational
pictures,
Services.
educational services.
Yes.
Okay, great.
And
Okay.
then I'm the executive director and founder.
Okay.
I founded it with my twin sister, Deborah Wyatt.
Mm-hmm.
And so as executive director, I oversee basically all the programming here,
Mm-hmm.
supervise all the staff, and just report to the board on a monthly basis, and then work on relationships with other organizations. And that's
Okay, so what's like the brief history? When did you establish and what are your main achievements so far?
we started 11 years ago in
11 years. Okay.
2007.
Mm-hmm.
Fresh out of university. There
Okay.
was not a program, or there was one program in Ottawa for children with autism, but the list was growing for needing services.
Okay.
So started a not-for-profit with my sister, and then it has grown probably exponentially since we
Exponentially.
started. Oh,
Okay.
absolutely.
Not the way, the dynamism that I see in your personality, the way you invited the other day so many diplomats and ambassadors, and today we are sitting here with you once again.
Yes.
So I think there is a lot of energy going on. So is it you are talking about some other exceptionalities also, like not only
Autism? So we don't believe that you have to have autism to need treatment,
Yeah.
and that the diagnosis shouldn't really matter. Obviously, if there's a diagnosis in Canada, there's access to funding, so that's the importance of the diagnosis.
Okay. There is
but
importance of diagnosis. If someone is not diagnosed with autism, still you will extend your services?
Absolutely, they don't have to have the diagnosis yet, or even if they're looking for a diagnosis, we offer psychological services so we can provide the diagnosis if that's
Psychological
what they're looking
services.
for.
Okay.
Yeah. But we do work with children with other exceptionalities. So we've worked with individuals with Down syndrome, with Turner syndrome,
Down syndrome?
Down
And
syndrome,
what is the other syndrome?
Turner syndrome.
Turner syndrome. Okay.
Yes. We've worked with children with ADHD, with global developmental delay. We've worked with kids with, any sort of kind of learning disability.
Learning disabilities.
Learning disabilities, yeah.
Personality disorders as well?
Not as much, no. It's usually more of a developmental
Developmental.
exceptionality.
Okay.
Yes,
Okay.
yes.
Developmental exceptionalities. Because of their nutrition or because of genetic, because of environmental factors?
A lot of that is still being researched.
Research, okay.
Yeah, some of them are genetic. I mean, if you're dealing with Downs, that would be a genetic.
Genetic, okay.
but-
Down, that is genetic, yeah, exactly. Yeah.
Yes, but autism is still, being researched as to what really causes autism. There's lots of theories.
A lot of theories, yeah.
Yes.
Not yet, we don't know exactly what are the causes of autism.
No,
Okay.
they have ideas.
They have ideas,
Yes,
okay.
yeah.
So research is still going on. So is your organization involved in the research as well, or just you are tackling and handling the people with the autism and other
We're more of a treatment
exceptionalities
center.
or treatment? Okay.
Yes. We'd love to do some research. We definitely have some of our own theories, but we're doing ABA therapy, applied behavior analysis.
Applied behavior analysis.
Yes.
Okay.
This is the main treatment that is approved and recognized world round as the only therapy that is effective in helping the child recover.
Okay.
Now, when I say recover, I use that loosely because I don't mean cure. I mean recover from the characteristics of their diagnosis. So a lot of our students could be on the severe end of the autism spectrum. So we would describe that as being aloof. So in their own world, not making eye contact.
Eye contact, okay.
Not at all. Not verbal.
they're not responding like to the stimuli
Not
when
at
you
all.
are not, when you're the teacher is talking, somebody is talking, so there is no response.
Yeah.
So this response, it is like somewhere in central nervous system or in your peripheral nervous system, or it is something physical with your physiology, morphology, where it is like.
All wonderful questions.
Yeah.
All things still being researched.
This being okay.
I mean, it is a neurological developmental disorder, so
Yeah.
obviously the neurological system's involved in that.
Neurological, yeah.
Yes, yeah. But these children on the severe end,
Yeah.
after treatment here, some of them are in regular classrooms learning a second language and don't have an assistant. Like they're
A second language and they don't have assistance. Okay.
yeah, so you wouldn't know that they're actually on the spectrum, which is totally doable if you have the right clinicians to provide the services. So,
So, for example, we have a question that there is some person who is like disabled physically.
yeah, physically, yeah.
So, do you have also chances for that person to come? Like, for example, some problems with the legs, some problem with the movement, with the hands, with some other parts of the body, or it is just only mental, psychological issues?
So are you referring to something like cerebral palsy?
Yeah.
We have absolutely taken students with cerebral palsy.
3 students for, what's the name of this?
Cerebral palsy. So that's caused by a lack of oxygen during
Lack of
the
oxygen.
birthing
Okay.
process.
Yeah,
so
yeah,
they
yeah.
don't
It's a
have
kind of
control.
paralysis, like something.
Paralysis,
Paralysis.
yes,
Okay.
yes.
Paralysis.
So we
Okay.
have taken students who have CP,
CP. Okay.
and they've done well as well.
They have done
But
well
there's
as
not
well.
as much research on individuals with CP and ABA. Does it work? Yeah, we've seen it work.
Yeah.
Do I have a large group of individuals with it? No, so I can't tell you that it would work with all of them.
So do you receive like groups of people from other countries? Do you provide them like some residential facilities, their visa, immigration? For example, there is a family, they want to bring their children from other countries like Pakistan. So would you facilitate in the whole process, or they should be here and then you give them admissions?
So we've had students come from all over the world, actually.
All
come
over the
see
world.
us.
Okay.
Yes, and we will assess them here. I have one coming from a country in Africa next month.
Okay.
And so they come here, we do the baseline assessment, we evaluate them, and then we design the program. And then depending on what the country wants to do, sometimes we can help them organize something similar back in their country. Or we do, use Skype. We come up with various ways that we can help them in their own country.
Exactly. Okay. So your success, for example, this is really a challenging task. Because the people, sometimes, we grown up people, we don't understand. We don't have any personality disorder, or we don't have any psychological or physical problem. Still teaching or learning is such a difficult thing. So then the people who are disabled, or they have some exceptionality and they have some disability. So it is a challenging task. What about your fortitude, your teachers, your faculty members, how they absorb such kind of stress? Because teaching to a normal person is very difficult.
Yeah.
If somebody is paranormal or abnormal, or that person is not according to the usual standards. So what are the techniques, like the teaching, learning techniques that you apply here?
Well, it's all based on ABA, so that's a whole teaching paradigm.
Based on
its own.
ABA.
Applied behavior analysis.
Applied behavior
Yes.
analysis, okay.
So, but as far as the staff goes, I can absolutely say they're all very caring individuals. You have to, the personality is a big part in what we do.
Yeah.
Education can be taught, personality cannot. You definitely
Education can be taught, personality cannot be taught.
Yeah, so when I hire, I don't just hire individuals that have, master's degrees and look great on paper. If I can't have a relationship with them, there's a problem, because you need to be creating a relationship with an individual who has no desire to have a relationship, right?
Yeah,
'Cause
exactly.
they're having difficulty.
That person doesn't have desire and you want to develop the relationship.
That's
It's really
it.
challenging.
It's very important.
Very, very important, yeah.
So it's based on ABA, but there's obviously other things that we use. Like within ABA, there are different paradigms that you can use. So there's verbal behavior.
Verbal behavior.
Is one form of therapy. There's
Okay.
discrete child training is another form. There's discrete child training, early start Denver model.
Early start?
Denver model.
Denver.
It's out of
Okay.
Denver. So
Okay,
early start
Denver, exactly.
model,
Yeah, Denver. Yeah, I know.
And then there's other things too, like we might use like a picture exchange system, like PECS. Like within a center and for an individual, everything we do is individualized. So
Individualized,
we will pull
okay.
from all sorts of areas, but the overall programming is applied behavior analysis. That's
Applied
the
behavior
principles.
analysis, that is the principle. That's
the
the
principle we're
fundamental.
using.
Okay,
Yes.
good,
Yes.
great.
Yeah.
Okay. So, when, for example, is it there some duration that, for example, those people, the disabled or the exceptionalities, they need your attention for 1 year, 2 years? It depends on individual to individual, or there is any tailor-made kind of thing, or customized, or how much duration one person needs, like
So it really depends. It's all individualized.
all individualized.
And that's the thing about autism and all these exceptionalities is no two kids with autism look alike.
Mm-hmm.
So, and it's hard to predict, but many of our students,
Yeah.
if they've gone 2.5 years full-time therapy,
Yeah.
we're able to start reducing, and then they start transitioning into typical school.
Typical schools, yeah,
So
exactly.
I can't promise that with every diagnosis, because if you're dealing with something where there's more of a global developmental delay,
Yeah.
then it becomes a
Global
more
developmental delay.
Yes.
So this global developmental delay, this is like applied to like all the people or some of them. Like for example, some people they have delay. So this yeah, no problem. Yeah.
Okay.
So global is like comprehensive. The word global here means
Global developmental delay used to be referred to as mental retardation.
mental retardation.
Yes,
Okay.
so there has been very limited programming for individuals with global developmental delay.
Okay.
So 10%.
Your members, like your professors, they might have got a lot of patience. Like for example, to be patient with such students. So, do you have some kind of problem of communication or cooperation between the students and the teachers? The relationship between the two, it is very challenging. So, did you have some kind of crises or things, or everything is smooth here, like the educational environment?
Oh, I'll never say it's totally smooth. Right? You
Yeah.
never know what's going to happen in a day in the life of types. But I mean, we deal with the children that are not able to participate in class because they're dealing with aggression or different things like that. And so we do put in behavioral programs
Yeah.
to deal with this, to eliminate that. And that's really our number one goal, because you can't teach a child as long as they're being defiant or as long as they're aggressive or any of these other behaviors that are getting in the way. But a lot of our kids, when they come in here, the reason why they do these things is because they're not understanding in a typical classroom, because
Yeah.
they don't have the skills to communicate. So when you start working on those skills,
Yeah.
a lot of the behaviors then go away.
Yeah. So this was really a very thought-provoking kind of interview with you, and we got a lot of like glimpses. So now we will be discussing what concretely we can do, and you're really doing a wonderful job, because as I already said, it is very difficult to educate people who they don't have problems, but still, learning is a very slow process. The people, they learn things, you have to talk to them repeatedly, by reinforcement, then by association, then you have to tell them, a lot of pedagogical instruments you have to utilize your science of teaching. I myself remain teacher, I'm still teaching, so I congratulate and thank you very much for your time, and we will continue our
problem.
discussions. Thank you.
Okay, no
Okay.
problem.